Hello, beautiful souls. Welcome back to another episode of Sistahs with a Purpose. I'm your girl, Leash.
And I'm Bree.
And you know, the purpose of our podcast is to always give you a little bit of sports, and then Bree is going to give you the health portion. And then we always love to bring awareness to whatever month we're celebrating. Today, we're not going to give no sports. March Madness just ended. The transfer portal is open, and just people are doing. It's going crazy right now. So we're going to save that for another episode. For April, we just want to bring awareness to autism. So as you can see, we have a lovely guest, Miranda. She is on the episode with us today. I'm going to go ahead and pass it over to Bree so she can get the introduction out the way.
All right, y'all. So like my co-host said, Leash, it is Autism Awareness Month. This one is very personal for us because as we've talked about in previous episode, we have a son that has autism. His name is Carson, and he just turned 7 in February. And this has been our life since he was the age of 2. So going on 5 years now. And Miranda has personally worked with our son for about 3 years. So Miranda, go ahead and introduce yourself. Tell us a little bit about your background, and we'll go from there.
Yeah, sounds great. I'm so glad to be here. So my background is I actually got my undergrad in speech, and I kind of just fell into ABA, which is a very common story for most ABA professionals. I started working at an ABA company that had speech in-house and was thinking like, oh, okay, I'll be able to do speech, and I started doing ABA therapy, and I just absolutely loved it. And I thought it was very rewarding, and we were able to help kiddos and families. And so I fell into that career. So I started as a therapist, eventually became a registered behavior technician or an RBT, and went back to school, got my master's, took the exam, became a BCBA. So I started out in the Houston area, and it's kind of taken me everywhere. I went to New Braunfels, and then was in San Antonio, and then was in Buda, and then back in San Antonio. So I've been in the field now for probably about 10 years. It doesn't seem like it's been that long, but it goes by fast. So, but it's been great. I've loved every second of it.
Oh, yes. And so we've had the beauty of working with you. We've seen a lot of change when it comes to Carson, and we obviously are going to talk about that today. So our very first question is, can you pretty much elaborate on what an ABA therapist does, the setting, what parents can kind of look for when they are offered those services?
Yeah. So what I do particularly is I'm a board certified behavior analyst. So when I say BCBA, it's short for that big mouthful of words. But I myself will see kiddos and kind of assess where their skills are at. And then from there, I would write a plan for them and goals that we want to see them achieve. And then the RBTs or registered behavior technicians are the one who actually implement the therapy. And so there's a lot of different models of therapy that can be done. There is most of them now are very like play-based, natural type settings. This can be done in the clinic. Usually it's almost set up like schools or like daycares, where they have their specific place and their specific desk that they might work at. They're able to go, have their playtime and then their outside time. But it's all across all these different environments that the RBT will facilitate working on those goals. So in addition to in the clinic setting, there's also home setting. So you can have a therapist come into your home and work with your kid as well. And that helps just because they're already in a setting they're very comfortable with and they're learning how to do things at home. And then how parents are involved is that kiddos with autism usually have some struggles with generalizing skills or being able to use those skills across a lot of different people in a lot of different settings. And so BCBAs will meet with parents to make sure that they fully understand the process of implementing goals and how exactly to work on them at home. And so it's very beneficial, and it is very important that parents are involved in that process, especially because we want to make sure that the goals that are being written are very meaningful to families as well.
And
So
implement it at home.
and implement it at home. Exactly, because that just helps overall like progress, with that consistency, and will help achieve
Mhm.
those goals so much faster.
So I'm glad you brought up consistency. So,
Mhm.
with your professional experience, how would you define actually what autism is as a whole?
Yeah, so autism as a whole, I don't know if anyone's ever heard the saying, when you've met one kid with autism, you've met one kid with autism, because the spectrum is so very wide and
Mhm.
it just looks very different for everybody. And so, though autism is directly, I guess, defined as like a neurologic condition, to me, it's
Mhm.
just defined as it's just a difference, right? It's a difference in the way that the kiddo may think, the way that the world is being interpreted. And so, we just kind of have to use those differences and their strengths to help them achieve the same goals and be able to have a great quality of life, whether it's being able to share moments with their families or being able to participate in a group setting at school. And so for me, autism itself is just differences, and just really embracing those differences, because a lot of them are just strengths in a lot of different ways that we might not be as familiar with, but they still are strengths for sure.
What are the common delays or weaknesses that you see with children with autism?
Mhm. So normally, what we see is we see delays in communication,
Okay.
and then we might see delays in social interactions. Those are the two big ones. So with communication, there's two different things you might see. You might see that your kiddo has started speaking and then might suddenly what seems to like regress or lose some of that communication, or you might see that there's just a delay in beginning speaking, and it's just not coming as quickly as you might be expecting. So you usually see it like that. And then with social interactions, you might see, again, similar with even very early on, playing things like peekaboo, playing very simple games like that. You'll either see a kiddo who's very involved with that and then maybe seems to lose that skill, or a kiddo that just doesn't always seem to engage in that and doesn't have that, like, usually been referred to in the past as eye contact, but even just like attention to somebody else and being able to reciprocate that, like I said, that interaction, and thinking that that is exciting and fun. And it's not that they may not think it's fun, because obviously kiddos with autism still love and enjoy, their parents. It's
They
just they're
do.
expressing it in a different way,
Mhm.
right? So those might be some early signs that you might see with that.
So you touched on two big ones that I know we saw with Carson. So Carson was about a year and a half old.
Mm-hmm.
COVID had kind of just hit, and
Mm-hmm.
we went from a child that was able to do ABCs, pointing out letters to dad, to us kind of noticing he just stopped talking. And I remember talking to my husband and was like, you notice he hasn't really been saying much lately. It just was like speech
Mm-hmm.
was like non-existent. And
Right.
so initially we thought, okay, we're on lockdown, it's COVID. He's not
Mm-hmm.
in daycare, he's not interacting with other children. Maybe it's, more of an interaction thing, something that we need to pick back up
Mm-hmm.
on. Um, you know, Being a nurse, it's textbook, right? You hear about
Mm-hmm.
autism, you learn about it, but you don't really understand it until it's in the forefront. You're dealing with it.
Mm-hmm.
And then the other key thing I would want to say we kind of picked up on was repetition with particular toys, and toys not being utilized maybe in their full form. It was like, I have a fire truck, but I'm not really playing with the ladder of the fire truck and moving it around the room. I just like to hit the same button and hear the siren of it.
Mm-hmm.
So we started to notice those two things, and that was one
Mm-hmm.
of the reasons why we wind up reaching out to a developmental pediatrician, which happened to
Mm-hmm.
be over at Fort Sam, and
Mm-hmm.
kind of got the ball going. But aside from those, a couple of things that I listed and the two things you talked about, are there any other symptoms that maybe a mom and dad or teacher or anybody watching that can kind of look for that might be early
Mm-hmm.
signs of autism around that age of like 2 to 3 when they're typically diagnosed?
Yeah, so you actually hit on, like you said, textbook, a lot of the classic signs that you do see. So talking about the like repetitive play that you see, you can also start seeing some repetitive speech. And so wanting to say the same sounds, the same words like over and over and over. Wanting to say phrases that they've seen on TV shows or that they, just hear phrases that people say. So you'll start seeing that, and that's actually referred to as echolalia. So you definitely might see some of that. In addition to that, there's a lot of different comorbidities with autism as well. So you might start seeing kiddos be a little bit more picky. All kids are picky, obviously, but you will see it to an extent where they might not be able to handle certain textures to the point that they would rather not eat than
Oh,
experience
yeah.
some of these textures, right? And so that is something that you might see too, that extreme pickiness with certain things. And then you might start to see too sensitivities to environmental sounds or sights. So if you notice that you go to the grocery store and your kiddo just looks very scared and just like covering their ears and just seems to be like hiding, then it might be like that type of environment is just a little bit too much for them. So you might see signs like that. Yeah, so just if you notice too an extreme sensitivity to like loud sounds, those are some other signs as well.
Okay. So when it comes to a child being diagnosed, what
Mhm.
are the steps that a mom would take? And then what is the actual test that a doctor would use to test for autism?
Mhm. So you would want to seek out a developmental pediatrician or a developmental psychologist. Most of them usually can diagnose autism. Um, Most payers or insurance companies do like to see diagnoses from like MDs, but there are some like psychologists that are PhDs as well can diagnose autism. So you would want to seek out somebody that does a what we call a comprehensive test, and so they will look at autism specifically, but they may also be looking at some other diagnoses or differences as well, just so that they can kind of get the full picture. So you would seek that out and get that scheduled. Once that's scheduled, then that professional usually will do an ADOS assessment or a CARS 2 assessment. So those are the phrases you'll hear a lot when we say ADOS assessment, CARS 2 assessment. And so those two assessments really just specifically take a look at skills related to some of those deficits that you might see with autism. And they kind of score that. And then at the end, they get that score, and it kind of, if it's put you in the range of autism, then you would receive that diagnosis, and they would write up a full report for you that lists out just different things they noticed or different things that they saw that the kiddo might be a little delayed in. And then once you have that, then you can then seek out other therapies once they have that diagnosis.
Okay. And what are some of the therapies outside of ABA that a child with autism might be receiving? Like, for instance, Carson, um, as you know, does speech.
Mm-hmm.
He does occupational and physical therapy
Mm-hmm.
on top of the ABA. So are those typically the common ones? Is there any more that I'm like missing? We just haven't added to our schedule yet.
Right? Those are the most common, specifically speech and OT. Just because when you are looking at delays, you can also start to see some motor delays as well. Just because um, the way that they're able to contact the environment, they may not just be learning those things as quickly, and so occupational therapy will be able to work on like the motor delays. They'll be able to work on some of those self-help skills that they may struggle with too. And then that speech therapy will be able to tell you, a speech professional will be able to say exactly like what types of communication or issues they might specifically need to work on, which can also be very informative to a BCBA working with a kiddo. In addition, like you said, physical therapy. Some kiddos do need that as well. Those might be kiddos that just really struggle with things like walking, balance, just being able to not trip, that those are some when you start seeing a little bit more struggles with just normal physical movements, like I said, walking or running. Then you might need that extra physical therapy. Those are really the main ones. And then we have some kiddos, like I said, they might be really sensitive to food textures. And so then they might need what's called feeding therapy. Um,
Mhm.
in my experience, I've had speech therapists and occupational therapists that have been able to work on that, but they do need to be certified for feeding therapy, is it's a very specific, it's very different and it's very specific specialty. And so that might be something else. And then in addition to that, it really just depends on the kiddo, because you do see a lot of comorbidities with a lot of different things. And so you might have a kiddo that also has like gastrointestinal issues, and they might need to be seeing a GI doctor, which might also be related to the diet and why they might not want to eat certain things, you know? So that's a really big one. And then some of our kiddos too might have issues with sleeping. So we might need to get like sleep studies done and see what's going on with that to just help them be able to get that rest at night so that they can, you know, experience the world and learn during the day. And so, yeah, I think those are really the big ones.
That is very true, because you
Mhm.
touched on a lot of things that we saw and we still see with Carson.
Mhm.
Eating being one, super picky. You did an
Mhm.
amazing job at helping us introduce food slowly with encouragement and rewards. We also, for a little bit of time, kind of participated in
Mhm.
a food program with where
Mhm.
the kids go and do their therapy. But it is limited, and when they're kind of stuck on something and it's a routine, they don't really want to open up. Our son went from just like chicken nuggets and mac and cheese bowls to, we were extremely excited because this year he started eating oranges, and
Mhm.
something that small people don't think about. We kind of jumped ahead and we started seeing a nutritionist, because my biggest concern was, yeah, he looks healthy
Mhm.
from the outside,
Right.
but is he getting all of his vitamins and stuff that he needs? And, you know, Carson's like our little mini sumo wrestler. So she was like, sure, you can add a daily vitamin, but I'm not really concerned, mom. But
Mm.
unfortunately, that's not the case with a lot of other children. There's
Mhm.
gastro, they can't communicate those things. And you talked about speech. And
Mhm.
sometimes these children are considered nonverbal, and you will see kids that have some form of technology to at least help them have some form of speech. Like we see the
Mhm.
iPads where they can at least do the minimum of trying to translate certain
Right.
words and stuff to you. Um, I know the other thing that you introduced for Carson was the picture board.
Yeah.
So we would always have the pictures of like, okay, he might not be able to say goldfish, but he could put the picture on there and say, I
Mhm.
want, and then it had like a little Velcro piece and stuff.
Mhm.
So um those are you've touched on some of the big ones. Do you have any questions
Yeah, no, I was just waiting to dive
about that
in.
part? I mean, autism
Mhm.
is it's so much that you can deep dive in. I mean, just on
Yep.
what we talked about so far, and
Absolutely.
still have more to talk on about it. Do you have anything that you're curious about?
Yeah, I wanted to dive more into the diagnosis part
Mhm.
because working in healthcare, being on more of the business side of it,
Mhm.
have you ever? So I just wanted to clarify what is the youngest age where you've seen a diagnosis of autism?
The youngest that kiddos can get diagnosed is actually 18 months. It's changed over the
Okay.
years for sure.
Mhm.
The youngest that I've seen is about 20 months, just from my experience. And so the earlier, the better, honestly,
Mhm.
Mhm.
because as soon as you can catch up on some of those things that have been missed, then they'll just continue to grow into right alongside their peers.
Okay. And have you
Mhm.
ever had to deal with, because obviously it's a sensitive diagnosis. No one ever
Mhm.
wants to hear, that their
Absolutely.
child does have it. But have you
Mhm.
ever had to deal with a situation where you're working with a family and they're like, "Oh no, we want to get a second opinion," and then they end up coming back. Um, and it happens. We everyone's human
Mhm.
nature. I think it's the
Absolutely.
same thing. So I was curious about that as well.
Yeah, so in my experience, I think by the time that parents are looking into ABA, they've accepted to some point that like, okay, like this is where we're at and we need to see what our resources are. So I have not personally had an experience where a parent was like, no, I need to get a second opinion, but I have had an experience where parents are getting a recommendation that maybe they were not expecting. as far as,
Right.
full time can be up to 40 hours a week. And so they might be like, okay, wait, but what about this? And what about school? It kind of just will refocus some of those things that they had foreseen, for their kiddo. And so I've had parents kind of be like, whoa, about some of the recommendations. And then they may, decide not to do ABA therapy because they may need some time for that. Or I have parents that will start and then they kind of have to, get their toes wet, and then fully get into what it is. And so a big part of what we also do through parent training, just by having parents that feel that way, is that we kind of help guide them into the process and help them have a little bit more understanding. Because I think that some parents, the biggest thing for them is that they feel like they don't understand their kiddo. And I know that can be so devastating to parents because they're like, this is my child, and where it turns out that they actually know them best. Because I know parents, in addition to you, Bree, have informed me so well about like what your child needs, like, okay, but he needs this and he does this. I'm like, you know what, you're right. And so also being able to work with parents in that way, it's definitely a team process. And so I try my best to, if they're not fully ready, to recommend to them like, hey, have you thought about support groups? Have you thought about talking to someone? Just because I can't imagine what it would be like to foresee like all of these things for your child, and not that your child can't accomplish that, but it's just going to look so different,
So different.
Right.
Mm-hmm. And so needing some time to kind of like accept that, and that's okay. It's okay if parents need that time. Like they're going through this whole process too with their kid. And so being able to recommend just other services like that for parents as well, if they need to take that time before starting ABA.
Okay.
Yeah, at
And
least you
then
asked a good question though, because unfortunately the average here in Texas is like they're not being diagnosed until they're 6. So for in the autism world, that's a huge kind of time frame lapse where the
It
average is
is.
like 2 to 3. I mean, you're
Mm-hmm.
6, you got to think the average child is already school age. So now a
Mm-hmm.
kid might already be in school, they're getting his
Mm-hmm.
diagnosis, and now they're being hit with, do we pull them for full-time ABA? Do we keep them in school? What services can the school offer? So it's quite a
Mm-hmm.
bit. And on top of that, unfortunately, Texas is behind with even an autistic kid graduating. Like we're at
Mm-hmm.
43% when the national average is 72%. So we're
Mm-hmm.
way, way behind. There's a disconnect in the school system, or a disconnect
Mm-hmm.
with either them being diagnosed. Somewhere we're missing something.
Mm-hmm.
yeah,
Yeah.
speaking of that, Bree, I was going to ask Miranda too.
Mm-hmm.
Is it offered in the school setting, or is it more just at clinics? I know you
Mm-hmm.
mentioned it being at home services as well, but is it offered? It just depends on the school district.
It really depends on the school district. So you
Okay.
might have schools that have professionals that maybe are like behavioral professionals, that they're referred to that way. It's just really important to know, like, okay, are they a BCBA? Are they certified as a BCBA, to know exactly the type of service that might be offered within the school. And in my experience as well, just talking with other professionals, sometimes it's one BCBA across a very wide range of kids, and they may not see them all the
Wow.
time. Yeah. And there's not that there's anything wrong with that. It's just very different because a kiddo in school has to be able to be there to learn. And so just if they're having some, problems with being able to learn, or because they don't have some of that communication, they might be having more like challenging behavior, that they can't just sit in the classroom and kind of understand what's going on. Then that's when a behavioral specialist might jump in and make a recommendation to the teacher for what they can do. So I think the biggest difference in getting that service through a school versus getting it at a clinic is that in a clinic, we're one-to-one. And a
Okay.
BCBA might have a caseload of 6 kids, 8 kids, maybe some go up to like 12 kids. As we're in a school district, you might have a BCBA that has like, 50 kids, 100 kids. And so it's just very different. And then you have usually
Yeah.
the teacher who's implementing a lot of the procedures, for what that kid needs, but they also have to, handle all the other kids in their classroom as well. And so I think the biggest difference is just more of like the one-to-one, being able to work directly with the kiddo.
Okay. And then what would you say is your preferred setting to work in?
I do prefer a kiddo being able to have that one-to-one support. With that being said, when you are looking at a transition from a clinic or in-home to a school, at that point, they need to start working on group skills as well. And so there needs, like, that's very important towards the graduation process, because if they go from one-to-one and you throw them in a big group setting at school, it's not always that they're going to generalize those schools very well to a group setting. And so you do want to have a place and a plan that is going to work on group skills too, so that you kind of fade out those one-to-one services type of thing.
Yep.
Okay.
We'll be able to talk on that because Carson starts school in August.
Yay!
Oh, wow.
So it's
So
exciting though. Yeah.
yes,
Yeah.
it is. So staying in the ABA field, what would you say a parent can say some of the short and long-term goals typically that we work on in ABA? And then how would they, when sitting down with you, how would they see the progress and how it's tracked and measured to see that their child is either meeting those goals or not?
Yeah. So I think it's really important for parents to know that the short-term goals may not be what you're expecting, because you still are seeing these long-term goals that you want your kid to hit. And so it's important to remember that these short-term goals are trying to get to a lot of these long-term goals. And if you have questions, like, please ask them. If you have concerns, please voice them. Because it's a, what did I say? It's a team like effort. You don't want to ever have a BCBA that's like, you need to do this. You're not comfortable with it, but you're like, but they said to do it. No, like, be able to express that concern. And if you're not sure how these current goals are going to get to your long-term goal, then, voice that and being like, this is really important to me and I don't understand why we're working on this. And so, for example, if you have a parent that's like, well, my kid can say, this 3-word phrase, so why are we working on like 1-word phrases? It might be that 3-word phrase is the only phrase that kiddo has. And because we want them to be able to communicate more consistently, let's start with something easy, which is a 1-word phrase, and we'll work up to that 3-word phrase. It's not that we're like, oh, we're only going to do 1 word. We're going to build on that. And so I think that's really important too. Sometimes we'll start with like the small part of this goal and we'll work our way up. And it may take some time, and it may take sometimes longer than you might be expecting. And so I think that's the most important thing, just knowing that some of those short-term goals are going to be turned into those long-term goals. And even I can give you an example specifically. I've had a parent, come in, and just like you said with Carson, like, they may really like numbers and letters, and their parents are like, oh my gosh, they're ready for school, let's go. But then they can't consistently communicate, which is just as important, because if they go in a group setting and they can't communicate and they can't advocate, it's not going to be a good time for them, And so I think sometimes it's just making sure parents understand we might need to put the brakes on that specific goal, but that doesn't mean that's going to go away forever,
Mm-hmm.
I think I answered your question. I got so many thoughts rolling with that.
No, you did. So,
Okay.
being in the field for 10 years, what would you say are some of the misconceptions that people have with ABA therapy?
Yeah, this is a big one, and I have a lot of parents actually ask me this too when we start ABA therapy, because there's a lot of information out there, and a lot of that information, of course, refers to the way that ABA therapy used to be. So ABA therapy is a relatively new field. It came about, I think, just in the 60s. It's still very new. When I say that, I just mean that it's still kind of like changing and evolving even now, and that's good. We're making some progress, and so I think previously some misconceptions about ABA is that they may be sitting at a table all day and they're just going to be working on eye contact, and maybe that's uncomfortable for them, but they're just going to be staring in people's eyes all day, or that they're not going to be able to have any fun. They're just, like I said, going to be sitting at a table doing things over and over and over again, or that for example, we use a strategy called prompting, and sometimes that might look like using physical prompting. And so being able to like help a kiddo, walk. And previously, I think that there were some misconceptions about how exactly that was used in ABA. So more recently, I like to speak on the shift that has happened in our field, which has been a shift to assent-based therapy. And the biggest thing with that is that we'll follow a child's lead. Not saying we didn't do that before, but more so follow their lead, kind of letting them decide where therapy is going to happen. It doesn't have to be at the table. It can be 100% during play, you know, it can be 100% going on the slide and doing this. You know, there's a lot of different ways to work on those skills. And I can give you some specific examples with that too. Um, but when we say assent based, it means that if a child is telling us, no, I don't want to do that, then we're going to say, okay, well, then let's talk about what you do want to do, you know, and we're going to reestablish some of that, the good relationship there, you know, with like, okay, what can I do to make you feel comfortable? And then when the kid themselves feel better and more engaged and they want to participate in therapy, then we might try to reintroduce an instruction like, hey, well, why don't we go sit down really quick so we can work on one thing, you know? So it's very much led by the kid in the way that we want them to be comfortable too. And we don't want them to ever feel like they're in a position where they have to do something they don't want to, that they are pressured to do something, or that they feel just completely upset by what is happening, especially because a lot of the population cannot voice those concerns. So that's been the biggest shift. And then actually the reduction in the amount of physical prompting that is being used. And so um, I know myself, the only time that I use any type of physical prompting is whenever a kiddo is in a situation where they're not safe. So if they're in a hallway and they are trying to run off, then I just stop them and I just kind of hold under their arms and kind of guide them back to the room just to make sure they're in a safe environment. Same thing with if we have a kiddo that's upset, they end up laying on the floor and we're concerned about, you know, them getting stepped on and things like that in the hallway, then like, hey, I'm going to just kind of help you move to this room so we can be safe. And then that's it. And kind of go from there. And so a reduction definitely in the use of physical prompts. A lot of parents get scared when we say like assent based and the kiddos kind of gonna kind of lead the session, you know, because I do have kiddos too that do need more direction and they do need to be pushed a little bit because that's just what they need, you know. And so there's definitely a fine line and there's a balance and it's different for every kid. It really is. So I think that's the biggest shift I've seen. It has been very positive, but then it's just, again, making sure that the way therapy is being implemented aligns with you as a parent and what you practice at home and kind of what your culture is at home, you know what I mean? And how you want things to be implemented. So that's very important. But yeah, just to give you an example too of when I say we can, do play based and we can go on the slide and still work on goals. If you have a kiddo that has a goal that's just to use a 2 to 3 word phrase to request, then every time they want to go on the slide, you might be like, oh, hey, what did you want to do? And they're like, oh, I want to go on the slide. Oh, okay, yeah, let's do it. You can implement a lot of these goals just naturally with them. It's just making sure they're doing it frequently. So they contact that. They contact.
You hear your little friend.
Yes, yeah, I do. But that they're able to work on those skills in a lot of different ways. So
that's good. So I think one thing we didn't touch on was meltdowns. They can look different for every parent. I know in Carson's case, it's a lot of screaming. It can be rearranging furniture, meaning he may want to stand on top of a table or push a chair down. Which his kind of looks like aggression is if from somebody from the outside looking in. But from an autism mom, it's too much. I just need my personal space. How would you tell a mom that's new to this journey, how do you guide them through the process of getting through those meltdowns? And then what do you guys offer to assist a parent with getting through that?
So we take information like that right from the get-go. Hey, tell me some of the struggles you have. Tell me some of the behaviors that you might see from them that are upsetting to you or that are hard to manage. We get that information right from the get-go. And then once we start ABA and we're able to observe that, we then look at environmental factors such as, well, why are they doing this? Like, what is the purpose? What is the reason? And then from there, once we find that they might be doing it because they just want to not do this specific thing or they want to escape, that's one of the things that we call it, escape, then we might be like, okay, how can we teach them an alternative to doing that specific behavior? How can we teach them how they can appropriately escape this situation. It might be that they are looking for some type of interaction, what we call like attention, an attention factor. They just need some type of interaction or something from someone, and that they're using that behavior to get that. And so if that's the case, okay, how can we teach them how to ask for that appropriately? Or how can we teach them how to like tap someone on the shoulder to get their attention, So we call those functions of behavior. So the purpose that a
Okay.
behavior is happening. Okay. So I said escape, I said attention. The other two that we see are what we call tangible. So it may be like they want someone, they want something, they're like, I want this. And they're using that behavior to then get access to that. And then what we call automatic or sensory, they might be just doing that because it feels good, right? They enjoy engaging in that. And so from there, then it might be like, okay, what's another sensory type activity we can introduce to them, so it helps manage that. And so those are the main things that we do. And then once we sit down with parents, we take them through that. We kind of explain, okay, here's how I assessed this. Here's what I saw. It seems like they do it for this reason. Is that what you see at home? And so I think it's really important to help them understand exactly what we see in our process, but then also getting information about, okay, what do you see at home? What exactly happens in those situations to make sure that the functions across both settings is the same? Because sometimes it may not be. It may be happening in a completely different way at home than it is happening in the clinic.
Very true.
Yeah. So,
You personally come to our
yeah.
home and we've had to, and like we mention, and parents hear it all the time, routine, routine, routine. Ours was this calming corner. We didn't have a calming corner at home. Ours was just like, okay, Carson, you're upset. Go ahead and go up to your room kind of thing, and kind of just giving him that a lot of time. And you had to come in and train me and my husband of like, no, actually have a place that he can go where it's a safe zone. He feels comfortable, and then providing us with additional tools of either counting or ABCs or something that just kind of refocused his mind off of the event that's happening until he's able to calm down.
Yeah.
And it's very effective. In the moment, you're like, you want me to do what? Like,
I know. No, I know. Yeah. And honestly, you saying that, sometimes what a BCBA might be telling you is like the complete opposite of what you want to do as a parent, like what your instinct is. Because when I say attention, if you have a kiddo that's doing something because they like hearing their parents say, no, don't do that, that's going to be a complete flip for parents, because it is very natural to be like, no, 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 don't do that. Like, you want to correct your child in the moment because, like, that's your child. You're responsible for them. You're like, I need to teach them, right? So again, differences. Okay, how we're going to teach them is going to look differently. I don't want you to use the word no. Parents are like, what? But what do you mean? What do you mean? You
give
don't
me a
want me to
trigger
say
word.
this?
Yes.
A better word. So sometimes that might look like, oh, I'm going to turn away for a second because they're trying to get my attention. And then once they stop doing that, then I'm going to be like, hey, like, then I'm going to give them attention. Right. And so I think that's the biggest change for parents, I think, when they see that their kiddos are wanting that interaction from them, and they're like, oh, I like being told no. And so that's also an important thing to know about autism as well, is that you have a kiddo that may like negative attention because, again, they don't always see the difference in positive and negative attention. They're just like, I want that interaction from somebody. And so I think that's important. But yeah, for parents, I think that's the biggest thing that is like, whoa, wait a second, I don't know how I'm going to do this. And in the moment, I know that it's hard to be able to do.
So I think the other thing we haven't really talked about is, how does this look for parents that don't have insurance? And how does this look for parents that do have insurance? Is this something that's costly? Do insurances cover ABA therapy, seeing the developmental pediatrician to even get the initial diagnosis? Like, what does that look like?
Yeah. So the process for ABA right now is that you do have to have a diagnosis. Once you have a diagnosis, then insurance does cover therapy, but it is going to look different depending on what insurance company or what payer that you're working with. So you may end up having a copay. Usually that's like a per day copay. And when you think about
Yeah.
a child going 5 days a week for a full day, that can definitely end up being costly. So I think it's really important to be looking at what type of plan you have. Does that plan cover, it is under mental health benefits, autism therapy. And so making sure you have mental health benefits, and then seeing how good those benefits are in your plan. Because you have some plans that may cover 100% mental health, but then they have at the bottom, okay, but not ABA therapy. You know what I'm saying? You have
Oh,
some plans that are
wow.
different, like, hey, but that's ABA therapy is different. um, so once you get the diagnosis and you seek out an ABA company, you then have to get what's called pre-authorization from your insurance company. Most ABA companies will do that for you, to where it's like, are you approved? Great, you're approved. Let's do the assessment. Then once you do the assessment, you then have to get pre-authorization for 6 months of therapy.
Hmm.
And so it can be a lengthy process just in trying to get authorization for services. Once those 6 months are up, you have to get authorization again for the next
Yeah,
6 months
yeah.
and
You
go
guys
through
love
all of
to
that
bring
Wow.
out
again.
that early. Brishana, you're coming around. Like, and you guys are really good at being like in month
Yeah.
3, 4. Hey, go ahead and start letting the doctor know he needs to start writing up his plan.
Mhm.
And you touched on it is a very lengthy process. It can be
Mhm.
costly.
Yep.
I can only speak from like a TRICARE standpoint. Yes, they
Mhm.
cover a lot, but those first, you used to hear me complain about it
Mhm.
all the time. The first 3, 4 months of the year, our
Mhm.
bills are insane because we have to meet
Mhm.
our $3,000 out of pocket,
Yeah, the out of
um,
pocket.
out of pocket. And so you have to think about Carson goes Monday through Friday. So like you said,
Mhm.
per day we're being charged that out of pocket. So it does get costly.
Yep.
However, you do have services like grants that you can look into.
Mhm.
As a resource to kind of help cover some of those costs. Do you have any in mind that you've worked with in the past, or any kind of resources that parents can kind of look into, websites maybe?
The biggest resources that can help parents get what they need, because I don't specifically have, hey, this grant or this specific thing, but it's Autism Speaks is a really good source for a lot of
Okay.
different things. Any Baby Can, especially specifically in
Mhm.
San Antonio, is a good resource. And then we also have a MAC center now
Okay.
that has a lot of different resources for parents with autism, and they have like everything in one building. And so any type of resource that you might need, they can lead you to that. And so that's the Mac Center is probably like a really the biggest one.
Okay.
And then your insurance companies honestly too can give you some resources as far as knowing what's covered, what
Mhm.
centers are covered for ABA. And then it does sometimes differ in like, do they cover in home? Do they cover in community, in school?
Mhm.
Do they cover in clinic? Like that's also important, the setting. And so that's all very important to remember too when you are seeking services. So to know that specific stuff, you are going to have to contact your payer for your specific benefit. And then I know too, I realize I didn't answer your question as far as if you don't have insurance,
Mhm.
kind of what are your resources there? Medicaid does cover ABA now.
Okay.
It is
Oh, wow.
in
Okay.
Texas. Yeah. In Texas. And so it's still very new. So you may not have like every center is covering, or is covered by Medicaid and doing ABA therapy. So that would be something to ask as well. Do you guys take Medicaid? What does that look like? And so that is something that's very new, and it is a good thing because
Yes.
it's letting them access these same services as well. I think the other thing too that some parents can struggle with, and again, I completely understand, is that they may be like, oh, I can pay for ABA therapy if it's like 15 hours a week. And then they get a recommendation. It's like, well, your child actually needs 30 hours a week. And then they're like,
Mhm.
okay, but can I do this many hours? And sometimes you'll have ABA companies that'll say, no, we can't. I'm really sorry, and it's not because we don't want to help the kiddo. It's because ethically, if we don't think the kiddo is going to make progress with that little of hours, then we cannot do services, just because there won't
Oh,
really be a
okay.
point to doing it if we don't think they're
Mm,
going to make progress.
okay.
So sometimes what we can do is if we're like, hey, we recommend this in the like 30 hours, and the parent's like, okay, well, I can only do 25, we might look at it and say, okay, listen, if we think their kiddo can make progress within 25, we're going to look at this for 3 months. And if we see progress, we can stay at 25. But if we don't see the progress we're looking for, then we are going to need to move up to 30, or, hey, we need to move up to 30 within a month. And
Mhm.
so it's not that we don't want to meet parents in the middle. It's that the recommendation that we're making is based on each kiddo and what each kiddo needs to achieve those goals that parents want them to achieve, or that they need to achieve in order to be able to do other awesome things, of communication being a really basic, good skill that they need to have for a lot of things. And so I think that's important for parents to know as well.
Okay. Leash,
So
did you have?
Miranda, yeah, I was gonna jump in. So going back to that, is that just the standard for the where you practice at or your standards, or is that like a global standard that if y'all are recommending, like you said,
Mm-hmm.
this amount of hours and they can only do this amount, I just want to know a little bit more about that because that is
Yeah.
interesting.
Yeah, so that's actually a national standard. So we have to
Okay.
follow the ethics code given to us by our board. So when I say board certified, it's just the board of basically a board of like applied behavior analysis. So
Okay.
it's the board that certifies like me, it certifies the RBTs. Like we have our specific ethics codes that we have to follow, as does any professional discipline. And so within our specific code, we have to be checking if services are beneficial. We have to be um, kind of doing like a risk benefit analysis, if services are going to have more benefit versus more risk. So there's a lot of things that go into that decision for, can we try to reduce by 5 hours, or can we do this many hours versus this hour, this many hours. And so um, it all kind of is based on that, and the recommendation that we make means that that's the recommendation we have for your kiddo to benefit the most from ABA. And so we do have to keep all of that in mind too, just ethically, because if you imagine that we're recommending a 30 to 35 hour program, a kid can only come 3 days a week for 5 hours, 15 hours, and it may just not be enough. Then every time they come back to the clinic, it's going to be like reteaching them the same skills over again, and there's not going to be any progress or benefit to that. And so it's just something that we have to consider as well.
Okay.
Wow. No, that is amazing because, like I said, being on the business side of healthcare,
Mm-hmm.
being in healthcare in general, everything's about the dollar, especially the way the U.S. healthcare system is set up.
Yeah.
So knowing that, y'all have these national standards out there and y'all are abiding by that, that's amazing.
Mm-hmm. Yeah,
So,
absolutely.
in closing, what do you wish people knew more about autism as a whole, as a community, as
Mm-hmm.
parents? Sometimes we don't get a lot of grace even going to the grocery store, and our
Yep.
kid help them. What would you say, like, if you could give anybody any advice just on the community we are that's rapidly growing,
Mm-hmm.
what would you say?
Yeah, I think the most important thing is being on the outside of a situation like that happening. When you're out, you're at the grocery store, you're trying to just, go to the store to get like one thing that you need, is that if you see something happening like that, like, because again, sometimes it can just look like, hey, that kid's not listening to their parent, but it's so much more than that. As an outsider, I would say just mind your business and keep going because when you have someone that's staring at you and you have people that are like trying to tell you what to do with your kid, it's so much more stressful for the parent and the kid. So
Mhm.
it's like at that point, if you're not going to offer some type of help, hey, can I help you, can I get you anything you need, then just keep walking. I think that's my biggest advice to somebody that's on the outside, is that because again, prior to being here, I was helping out a parent, and we were out with people, and to feel that, like, I could feel people looking, and I'm like, I feel this, and I'm not even the parent in the situation. I can't even
Yeah.
imagine what that feels like,
Mhm.
when you're like just trying to go to the store because you really just need, a gallon of milk. It could be one thing that you need, but you have to go out.
Yeah.
And so I think that's the biggest thing, as far as like when you see something happening out, because you don't know the situation, just let them handle it. Unless you're going to say, hey, do you need anything, can I get you some help, or something like that. And even in that case, if the parent just like, no, I'm fine, then just keep walking. um, in addition to that, I think really a really important thing that I want people to know about autism is that autism is very different for every kiddo. So same thing I said at the beginning. If you've met one person, with autism, then you've met one person with autism. It looks very different for everybody. And so um, I know a big thing with like TV shows right now is that, like, oh, they're a savant. They have this really great skill they can do because they're autistic, and that's just not the standard. That's like one person may have that great skill, or hey, this kiddo may be able to do this, but it looks a lot different than, this type of skill you saw on TV. They still have their strengths, but it's just going to look different for every kid. And then I think the other thing is there's a misconception for people that are diagnosed with what used to be referred as Asperger's. Now it's just under the umbrella of autism spectrum disorder. It's not its specific own diagnosis anymore. But sometimes people have a misconception that they're being rude when they're not meaning to be rude. And it's just because they say what's on their mind. Sometimes they say it very direct because they don't have inflection or they don't know how to joke or, use sarcasm. I'm not saying that's the case for everybody. I'm saying like I've been in a situation where that has happened, and
so I thought it was coming.
In a situation where it's like, oh, well, they're just rude, and so they'll be rude back to them, and then it's like they don't even understand like what is happening, And so I think it's just really trying your best if you do know someone, and especially if you know like an autistic person, is talking to them, being able to communicate like, hey, you said this and that was kind of mean, and they'll be like, they might be like, really, I didn't even realize, because hi,
who's that?
Miranda.
Like he's
Dang.
yeah he's not hiding. Hi, baby.
Say hi.
Not him making a guest appearance.
I know, I love it.
I think he could hear her voice because he kind of got closer and closer and closer. And I'm like, you can come on. It's fine.
Come on. Hi, baby. Look at you. Big boy.
We'll open it. We'll open it.
All righty. Y'all get to see Carson. Y'all hear about me talk about him all the time.
I love him so much. But yeah, it's just treating autistic individuals with the same dignity you treat everybody else, and the same understanding, and knowing that everybody's different. Every person with autism is different, the same way that every individual you meet in the world is different. And then I think other than that, it's just being willing to make some accommodations if they need it, whether they're a kiddo or an adult,
Yeah.
Like we said, Carson is very visually, like he needs visually inclined. He needs like visuals to help prompt him with stuff. And so, one day when he's at work, like, hey, let him have as many visuals as he needs. Let him have a little pocket visual he might need, like making sure that those type of accommodations are given to whoever needs them, even if it's not the standard. Well, let's change the standard, just giving people what they need. I think that's a really big one for me. Just being understanding and being willing to help them achieve the same goals that everybody else is able to achieve.
I don't think I've ever asked, does ABA have an age cutoff? Because, we're starting to see like a trend of adults being diagnosed with autism.
It depends on where you go. So a lot of places, if they have early intervention, then they might just go to age 8, age 10. And it's not to say, oh, we're only working with little kids. It's because when you go from age 2 to age 22, that looks very different. Because, once you start hitting puberty, adolescence, being an adult, you'd be working on completely different skills. And so some places that have early intervention, it's because they're specialized in that, and they may not be specialized in working with adolescents and adults. And so that's something that if you do have an adult in your life that's been diagnosed, then it's going to be important to be able to ask, okay, do you offer adult services? What does that look like? What are some things that you work on with adults? Unfortunately, it seems like there are not as many places that work with adults as there are with kiddos. And so your search might be a little bit harder, but there are places out there that work with adults. There are also more like group type of facilities for adults. And so it might be like, hey, on the weekends, we do this like little social activity for this, kids ages, or even teenagers, 16 to 20 or whatever it might be, just to give you an example. And so again, just knowing what your resources are by, going to the MAC or going to Any Baby Can in the community. even on a really popular show, on Netflix right now is Love on the Spectrum. So even
I love that
It
show.
just
it's
recently
such
that, and I'm
a good
excited to
show.
watch
It's such a good
it.
show.
Yes.
It's such a good show, and I bring it up because I, as an individual like who is in the profession watching that show, I was like, oh my god, this is so beautiful. I love this. I sat down to watch it with my family, and they were like, wait, why did they do this and why did they do this? Realizing that they don't understand what that looks like because they've
Right.
only seen autism in one way. Because I do have a cousin with autism, so they've seen what his life looks like, but they haven't seen what this looks like, And so sitting with them and explaining that to them, it almost helps bring awareness to it. And so again, there's a woman on that show. I don't know like what her certification level is, or whatever, but she works with them on. She's also autistic herself, and she works with them on skills like being able to go on a date and knowing how to have a back and forth conversation on a date. Like I was like, I want to do what she does because I love that, like it's great. And being able to explain it to them in a way that they can understand. So she uses visuals, she draws some pictures. She like, let's talk about this, And so those services are going to look different, but they are there. You just might have to look a little harder to find them for like older teenagers and adults.
Okay.
Okay.
Alicia, I'm gonna let you close us out.
Okay,
like
well,
you always
before we
do.
close, I did have one more question I wanted to ask
Absolutely.
because I'm just like, this is so interesting. So,
Mhm.
Miranda, you were talking about the short-term goals and the long-term goals. When you accomplish those goals, does the diagnosis go away, or is it once you're diagnosed, it's forever?
So the crazy thing is that once you're diagnosed, it's there. You have autism.
Okay.
You're autistic, and so it's there. But your payers will make you get that diagnosis every 2 to 3 years, like it's going to go away.
Wow.
Yeah.
Okay.
So I have had in rare situations. I myself have not had a kiddo lose a diagnosis, but if it turns out that a kiddo makes a lot of progress and they go to the doctor and they're not able to see a lot of the same like symptoms of autism, which is what they look at from the DSM-5. It's that big manual of different mental health and medical issues. And so um, if they don't see those same things and they're not meeting criteria to meet it, is they can lose a diagnosis. But I have not worked with anyone that has lost a diagnosis myself.
Okay.
And so usually, yeah, it's something that you probably will be dealing with, your whole life, but it's not something that's going to hinder you at all. Like you just have to learn how to do things differently in the world and get all the resources that you need and the accommodations that you need. Because again, to me, autism is not something that needs to be cured. It's just we have to teach them in a different way, and we have to figure out what their strengths are, And so it's just who they are. It's just how their brain works, how they interpret the world. And so that was a good question, though.
Yeah, no, I was just curious because I'm like, why
Mhm.
does the insurance companies are already nosy as it is? So I'm like, why do they every 6 months you have to get a
Yep.
pre-authorization? Like, why is that even required if they're telling you this is the diagnosis?
Yeah. I couldn't even tell you. There's so many things I could tell you about. But the biggest thing is that they will try to be like, okay, but you've made this much progress, so why are we not requesting 25 versus 30 hours, And so it's
Right.
really important too that you have a BCBA that's going to advocate for what your kid needs or what your adult needs, So what is needed for them. So I've worked with, insurance companies. I've had to do what's called a peer-to-peer review, where it's like, hey, they want to know why exactly you're requesting this amount versus this amount. I'm like, okay, great. I'll get on the phone with them. And I've had some give a little pushback, and they're even just like, okay, but instead of 35, why don't they do 33? And I'm like,
Really?
okay, yeah, I'm serious. And then at that point, I'm like, okay, 2 hours a week is what, like almost a half hour a day. And then at that point, because like I want to make sure the kid's going to get services, and I have to think about, okay, do I think that minus 30 minutes a day they can still make progress? And I might be like, okay, yeah, that's fine, because I can foresee that they will still make progress. But if I'm like, that is gonna literally I'm serious, like 2 hours and a 30-minute, like they need as much time as they can get. So no, I don't think that that's gonna benefit them, um, because we want to recommend exactly what the kid needs, but we do still have to practice by payer standards, not to the point where we're completely listening to them, but to the point where we're not going to hinder a family's ability to get services, for sure.
Right. Okay. And so as we close, Miranda, I just wanted to confirm. So are you independently contracted, or do you work for a company?
I did previously work for a company. Right now I'm going through a move. I'm moving to, to another city. So I'm going to be closer to family to help out with some stuff with my family. And so I'm going to be in a different city. I'm kind of going to see, this is another thing I'm really passionate about. Where I'm going, I don't think there's a lot of resources for people diagnosed with autism. And so I'm going to see what's out there, and I'm going to try to do what I can to see what type of resources are, try to make resources if I need to, and go from there. And so that's kind of where I'm at right now. So right now, not actively practicing, but it's my plan to
Okay.
practice again. Yeah.
Okay. Well,
Yeah.
no, this was very informational. I do want to thank you for allowing us to interview you and bring you on our podcast.
Of course.
That's the purpose of our channel. We
Mhm.
just love to just bring awareness. And
Absolutely.
Bree, thank you for opening up and letting Carson come on. He was on
Yeah.
for a couple of
He is right next to me as we
It was
speak
so
with
good
the
to see
tablet.
him.
The tablet and graham cracker time. But no, thank you guys so much.
Yeah.
Of course.
And
Thank you for having me.
yeah, and before we close, I do want to just make sure everybody knows Bree did publish a book. So
Mhm.
going back to when Miranda was talking about those resources, it is on Amazon. It is called Carson, What Do You See? It is Carson with a C, so Carson, What Do You See? Type that in Amazon, search for it. It will pop up. Purchase the book. It is a great book. I have a copy myself.
I have a copy too.
Yes.
We signed a couple of copies too, but we're planning for a second book to roll out this year.
Oh,
It will be
wow.
That's
Breaking
gonna be
news.
fantastic.
it will be a zoo edition, because
Yes.
Carson, Miranda, and his animals. So we're like, part 2 has to be the zoo. So
It does have to be something
I
animal
love
related.
that.
yeah, so
I
we're
love
looking forward
that.
to that. Yep.
Oh man, I love that. All right,
Beautiful.
so as we conclude our episode, please make sure to like, comment, and subscribe to our YouTube channel. We are still continuing to get monetized. Our viewing is going up. Our subscribers are going up. Again, thank you, Miranda, so much for taking some time out to come on our episode.
Of
And until next
course.
time,
All right.
bye.
Bye.
Ah, 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 ah.